There is more than one winner on tonight's Dancing with the Stars. One of the show's judges is back to living an active life after battling a spinal condition that affects more than 400,000 Americans.
All right, Carrie Ann.
For Carrie Ann Inaba, movement has been a way of life. But 2 years ago, the former dancer suddenly found herself in severe pain on the set of Dancing with the Stars.
It was in the middle of a season, and I started to feel really, really stiff. I think it was 2 seasons ago, and it just got worse and worse. I thought maybe it was because I was working out, or maybe it was because I wasn't working out. I couldn't figure out what it was. I tried everything, and nothing helped.
The diagnosis? Spinal stenosis, a narrowing of the spinal canal that causes pinching of the nerves. She says she underwent surgery and steroid injections to relieve the pressure.
And it's pretty bad, and I still have to watch it.
If you get the patient very young, like Carrie Ann, I think that if there's not a lot of deformity of the spine and not a lot of nerve damage, essentially they can resume a normal lifestyle.
San Francisco surgeon Kenneth Light says new techniques are allowing doctors to treat spinal stenosis much more effectively. He says in the most common procedure, laminoplasty, surgeons delicately remove small bone spurs from the interior of the spinal column, creating more space for the nerves of the spinal cord.
We found that through microsurgical techniques, we can go in and just remove the offending bone spurs and not have such a destructive operation to the rest of the spine.
He says the less invasive technique typically preserves more stability in the spine, making it less likely a patient would need to undergo a spinal fusion as part of the procedure.
You know, dancing would be certainly possible.
Since her treatment, Carrie Ann has turned to stretching and exercise to keep her back flexible and hopes to avoid future surgery down the road.
Like I do inversion tables, I do yoga, I do acupuncture, I do biofeedback, I do massage, I do everything to make sure it stays okay.
Carrie Ann Inaba.
Dr. Light says in more complicated cases, disc replacement and advanced fusion devices can also offer relief.